He is 30 years old patient. He has double lip, both in upper and lower bichelia. And I am planning to operate under local regional anesthesia. For the upper lip, the ideal block is bilateral infraorbital block. And for the lower lip, the ideal block is bilateral mental nerve block. Right? These two, the anatomical landmark for the infraorbital nerve and for the mental nerve, and I will demonstrate you both these foramina, the mental foramina and the infraorbital foramina, they lie in a vertical line. If you draw from the mid-pupillary margin, see, from the mid-pupillary margin, here I have marked the entry point for this infraorbital nerve, and this circle indicates the entry point for the mental nerve. Both these are in the pupillary line. Now here I will demonstrate to block the mental as well as the infraorbital nerve through oral approach, although they can be blocked from outside. This most comfortable thing is just sprinkle few drops of fluid, local anesthetics, just to anesthetize the mucosa here. In the same way, you just put few drops there and few drops here and wait for just for 30 seconds or so. This will anesthetize the sulcus mucosa so that the prick of the needle is not troublesome to the patients. So I am planning to give 1 ml local anesthetic solution at all the 4 sites, and after the block of both the mental nerve and infraorbital nerve, I will repeat the block to enhance the anesthesia time. I am blocking the mental nerve, put the tip of middle finger over the site of the mental nerve, invert the lip with the help of thumb and index finger, and from here, under the guidance of tip of middle finger, inject 1 ml of the solution. Just 1 ml of the solution here. Don't touch the periosteum, it's really hard to the patient. I have given 1 ml of the solution here. In the same way, I will block the opposite, means right mental nerve from the intraoral approach. Just inject 1 ml of the solution here. Now I am giving the infraorbital nerve block on the right side. Put the tip of middle finger over the infraorbital foramina, invert it, see, and then from here, under the guidance of tip of middle finger, inject 1 ml of the solution here. Now in the same way, block the left infraorbital nerve, just invert the lip, and from here inject 1 ml of the solution. Now the block is complete. So I have given 1 ml each side. The total volume I have used is 4 ml. Now this will anesthetize the upper lip. The area of innervation of the infraorbital nerve is this, means this much area, and then lower lip and this much of the area. This is supplied by the infraorbital nerve. On this side, this area and this area is supplied by the infraorbital nerve. The mental nerve, whole of this area is supplied by the both mental nerve. Now I have already operated under bilateral mental and bilateral infraorbital block. I am giving all the 4 blocks from external approach, and I have taken insulin syringe, and that has 30 gauge needle. So I will inject half to 1 ml on each side, and this is very quick. So I am giving the mental block from outer side, see, injecting 1 ml here. Now I will repeat all the 4 blocks and giving 1 ml of the solution. Now from this side, this is the mental nerve block from the external approach. This will provide post-operative analgesia at least for 2 to 3 hours, even more than that. Now I am repeating the infraorbital block From the external approach, just put the tip of index finger over the infraorbital foramina and inject half to 1 ml of solution this side, and the same way inject half to 1 ml of solution near the infraorbital margin to provide postoperative analgesia. All the blocks are complete. They will act as a postoperative analgesia.